Child with special needs. Today, in this child with special needs, we are going to deal with hearing or auditory impairment. The objective of this lesson is to impart knowledge on basic issues concerning hearing impairment. That is, the classification or types, characteristics or symptoms, etiology or causes. The second objective is to plan developmental intervention programs for children with hearing impairment. Knowledge about the diagnosis, treatment and management therapies is very much needed. Hearing impairment is one of the most common sensory impairments. It affects people of all ages and it can be permanent if it is not treated correctly. Proper diagnosis rests on thorough understanding of the ear anatomy and physiology. There are various ways you can deal with hearing loss. Hearing aids and other devices can help you hear. Everyone knows about hearing, but what about hearing loss? Hearing loss, which is also called as hearing impairment. Hearing impairment happens when there is problem in one or more parts of the ear. The word impairment means something is not working correctly, or it is not working as well as it should be working. Someone who has hearing loss may not be able to hear some sounds, or he may not hear anything at all. People uses the word deaf, deafness, hard of hearing when they are talking about hearing loss. To know about hearing impairment, it is very much necessary to know how hearing occurs or how ear works. The ear is made up of three different sections: the outer ear, middle ear and the inner ear. These parts work together, so they process the sound and that you can hear. Now, let us see how each part works. The outer ear or pinna, which is called and which you can see outside easily, it picks up the sound waves. The waves then travel through the outer inner canal. When the sound waves hit the eardrum, which is present in the middle ear, the eardrum starts to vibrate. When the eardrum vibrates, it moves three tiny bones in your ear. These bones are called the hammer, the anvil and the stirrup. They help the sound to move along in its journey into the inner ear. These vibrations then slowly traveled into cochlea. Cochlea is filled with liquid and it is lined with cells that have thousands of tiny hairs on their surface. There are two types of hair cells, the outer hair cells and the inner cells. The sound vibrations make these tiny hairs move. The outer hair cells take the sound information and amplify it. Amplify means makes it loud and then they tune it. The inner hair cells send the sound information to your hearing nerve, which then sends it to your brain, then you are able to hear. So, this is the way the ear works. Now, after understanding how a ear works, let us now try to understand what is hearing impairment. Hearing impairment, it is a general term for all abnormal condition in which a person experiences deterioration or loss of hearing. Hearing impairment can also include muffled hearing or distorted hearing. Hearing impairment can also be called as hearing loss. It can be a symptom or a result of variety of diseases, disorders or conditions. Hearing impairment can result from a conductive problem in the outer, middle or inner ear, or these can be due to result of ear infections, ear wax blockage, ear tumors or a ruptured eardrum. Hearing impairment can also result from a problem with eighth corneal nerve. This is called sensory neural hearing loss. This type of hearing impairment occurs when the acoustic nerve is injured or damaged and is unable to conduct sound impulses from the ear to the brain. So, this is in general about hearing impairment. Types of hearing loss. Before we describe the types of hearing loss, first let us know how the sound can be measured. Sound is measured by loudness or intensity. The units for this are decibel. And sound can also be measured in frequency or pitch. The units for this is hertz. Regardless of the cause, hearing loss falls into the following categories depending upon the part of ear that is affected: conductive hearing loss, sensory neural hearing loss, mixed hearing loss, central auditory processing disorder. Conductive hearing loss. When the structure in the outer or middle ear do not work properly, their ability to conduct sound vibrations into the inner ear is affected. A buildup of wax in the ear canal, a punctured eardrum or ear infection often causes conductive hearing loss. The tiny bones can also become immobilized and lose their ability to vibrate. Conductive hearing loss can often be surgically or medically corrected. What are the causes for conductive hearing loss? Let us see. Buildup of wax in the ear canal, damage to the very small bones, the fluid that sometimes stays in the ear after a ear infection, when any foreign object gets stuck in the ear canal, a hole in the eardrum, scar on the eardrum which comes because of repeated ear infections. Sensory neural hearing loss. When the inner ear does not properly process the sound vibrations, messages cannot be passed on normally to the brain. This is called sensory neural hearing loss. It can result from genetic defects, a severe infection such as mumps, meningitis, head injury, or because of certain medicines or abnormal growth in the ear, or it can also result from aging, or even sometimes the loud noises can also damage the cochlea. This type of hearing loss cannot be reversed by medical or surgical means, and then therefore it is a permanent hearing loss. What are the causes of sensory hearing loss? Let us see. Acoustic neuroma, age related hearing loss, childhood infections like meningitis, mumps, scarlet fever, measles, etc., Meniere's disease, regular exposure to loud noises, and use of certain medicines can also result in sensory neural hearing loss, which is a permanent hearing loss. Mixed hearing loss. When combination of conductive and sensory neural hearing loss occurs, it is called mixed hearing loss. Central auditory processing disorder. Central auditory processing disorder is not a hearing impairment in terms of reduced hearing sensitivity, but instead a difficulty understanding the meaning of incoming sounds. A child can hear but is not effectively interpret the sounds or structure his or her auditory world. This can be compared to the visual problem of dyslexia. So, these are the types of hearing loss. Now, let us see the degrees of hearing loss, that is the extent to which the hearing impairment occurred. The hearing loss is generally described as slight, mild, moderate, severe or profound. This depends upon how well a person can hear the intensities or frequencies most strongly associated with the speech. Mild hearing loss. A child with mild hearing loss usually has normal speech, but will have trouble in school settings because it will be difficult for the child to hear the speech from more than 12 feet away or when there is a background noise. Some children with mild noise are not suspected of poor hearing until they reach the first grade. They are often thought to be slow because they cannot understand what the teacher is speaking and they respond erratically. When these children receive hearing aids, the school becomes much easier to them. Moderate loss. When the children with moderate hearing loss can clearly hear speech only when the speaker is very close, that means less than 2 feet away. They need hearing aids to hear the softest sounds and to acquire understandable speech. If they receive hearing aids before 4 years of age, they usually progress rapidly in their learning to talk. Then these children can attend the regular schools, but they need some special help. Severe loss. Children with severe hearing loss do not perceive speech, no matter how close they are to the speaker. They will not learn to talk intelligibly without hearing aids and special help. Severely impaired children who receive hearing aids early have a better chance of acquiring speech than those children who remain unaided for a longer time. All children with severe hearing losses require special help because they receive only a portion of the clues usually available in speech sounds. With lip reading and listening together, they may receive about half of the clues that normal hearing people use to understand speech. Profound loss. Children with profound hearing loss receive even less auditory information. The younger children, when fitted with hearing aids, the greater the likelihood that they eventually will speak. Having suitable hearing aids at all times is a significant factor in determining whether the child will learn to speak. Children with profound loss often depend greatly on their vision to perceive speech. These are different types of classification of hearing loss. Now, let us move on to see what are the characteristics or symptoms of hearing impairment. The common symptoms which we see in hearing impaired individuals are they do not respond consistently to the sounds or to his or her own name. They ask for things to be repeated often. Every time after a question they say "huh." They want the question to be repeated because they are not able to hear clearly. And we also find there is delay in developing speech. Even the speech is there, they do not have a clear speech. And another common symptom is they turn the volume of the TV or any other electronic devices to a very loud way. These are some of the common symptoms. Now we will see the general behavioral characteristics of hearing impaired children. Intelligence. Intellectual development for people with hearing impairment is more a function of language development rather than a cognitive ability. Difficulties in performance appear to be closely associated with speaking, reading, and writing the language, but not related to the level of intelligence. Speech and language. For children who are born deaf, speech and language skills are affected severely. These children have a very difficult time learning to use speech. Sounds produced by them are difficult to understand. Deaf children exhibit significant articulation, voice quality and tone discrimination problems. They babble less than their hearing peers. Social development. They have less language interaction during the play. They prefer small groups rather than a large group. They spend less time in cooperative play, though they are interested and initiate the interaction. When they grow up, their social and emotional growth is hindered due to their language impairment. They are low in maturity, awareness of social moods and attitudes, and social interactions. Educational achievement. Deaf child's educational achievement is significantly delayed when compared to the normal children. They have considerable difficulty succeeding in normal educational system, as the normal education system mostly depends on the language, spoken language. They are 3 to 4 years below their age appropriate levels. So, these are some of the behavioral characteristics of a hearing impaired individual. Now, let us try to see what are the causes for hearing impairment. The causes of hearing impairment can be at 3 levels. They are prenatal, perinatal and postnatal. Prenatal means the causes before the childbirth which resulted in hearing impairment of the child. Perinatal means the causes during the childbirth, that means during the delivery of the child which led to the hearing impairment. Postnatal means the causes after the birth of the child which led to the hearing impairment. Now, first we will see prenatal causes, that is before the child's birth. Prenatal infections and toxic conditions of the mother. Mumps, influenza and germal measles infected by the mother. Genetic conditions like the hereditary degenerative nerve deafness, which is called osteosclerosis. These are the prenatal causes of hearing impairment. Now, we will see the perinatal causes. Traumatic experiences during the delivery like the pelvic pressure, use of forceps or intracranial hemorrhage. Lack of oxygen due to prolonged labor or heavy sedation blocking the infant's respiratory passage, or cytomegalovirus or hepatitis B, syphilis. All these may cause hearing impairment in the child. Postnatal causes, that is the causes after the birth of the child. Low birth weight, drugs, head injuries, childhood diseases like the mumps, diphtheria, whooping cough, measles, typhoid, pneumonia, influenza, meningitis, otitis media, concussion, prebiscus. All these may result in hearing impairment of the child. Sometimes abnormal development in the inner ear causes to the conductive hearing loss. These are some of the causes or factors causing hearing impairment in the child. The tests used for screening and assessment of hearing impairment include the following. Infants. For infants, 2 hearing tests are often used to screen babies. In both the tests, no activity is required from the child other than lying still. The tests are autoacoustic emission test. Can show whether the parts of ear respond properly to sound. During this test, a sponge earphone is placed into the ear canal. The ear is stimulated with sound and echo is measured. If there is no echo, it indicates hearing loss. Auditory brain stem response test. It checks how the brain stem and the brain respond to the sound. During this test, the child wears earphones and electrodes which are placed on the head and ears. A mild sedative may be given to the child to keep him calm and quiet during the test. The doctor then sends through the earphones and measures the electrical activity in the child's brain. Older infants and toddlers. For older infants and toddlers, 2 screening tests are recommended by the American Speech Language Hearing Association. They are Visual Reinforcement Audiometry (VRA). It is highly recommended. Whenever the child looks around a sound source, she will be rewarded. This is usually for the children in the age group of 6 months to 2 years. Conditioned play audiometry. The child performs a task like puts a block on the table or touches a toy whenever he hears a sound. This is for the age group from 2 to 3 years of age. Now we will see the test for a preschooler. Conditioned play audiometry, tympanometry, additional testing of acoustical reflex and air volume test of ear canals. Now we will see the test for a school age child. The audiologist may conduct some basic test. The air conduction test is the most general hearing test as it evaluates the entire mechanism, the outer ear, inner ear as well as the hearing nerve. Soft tones are played through a set of headphones to determine the hearing threshold for different pitches. If there is a hearing loss, bone conduction test can help you determine whether the problem is in the outer, middle or inner ear. A small vibrator is placed on the skull bone directly behind the ear. When the sound is transmitted through this device, it bypasses the outer and middle ear and delivers the sound vibrations directly into the inner ear. Tympanometry. It tests the flexibility of the eardrum. The eardrum must be extremely pliable so it can respond to the softest impulses. But sometimes the eardrum stiffens and it takes a stronger, more forceful sound wave to make it move. The audiologist determines its flexibility by taking some air out of the ear canal and pumping some back into it. As he does this, he measures the minute movement of the eardrum. Word test. It sheds light on how well one understands the normal conversations. There is a difference between being able to hear words and being able to understand them. The speech reception threshold test determines the softest level at which the individuals can hear the words. The speech recognition test determines how well an individual can understand the words spoken at normal volume. The words include all common phonemes that are the basic sounds of normal conversation. Ear examination. During an ear examination, an instrument with a light at the end called audioscope is used to look for anything abnormal, including a blockage caused by earwax, ear canal infection, bulging eardrum, fluid behind the eardrum, perforated eardrum or a collapsed eardrum. The next test is the tuning fork test. Tuning fork is a wire metallic shaped object. It produces sound waves at a fixed pitch when it is generally tapped, and it can be used to test the different aspects of your hearing. So, these are some of the tests an audiologist uses to check a hearing impaired individual. Hearing aids. Hearing aids are devices that are fit inside your ear or sometimes behind the ears. They do not restore hearing, but they just electronically amplify the sounds going to your ears. Some hearing aids amplify the higher frequencies to improve speech recognition. Directional microphones boost the sounds coming straight at you so that you have an easier time hearing conversations. Telephone switch. It filters the background while you are on the phone. Cochlear implants. They are electronic devices that create sensation of sound by directly stimulating the hearing nerves in the inner ear. It doesn't amplify what your ear is hearing, but instead directly stimulates the auditory nerve, which sends the signal straight to your brain. Middle ear implants. They are option for people who either cannot tolerate or do not benefit from hearing aids, but whose hearing loss isn't severe for cochlear implant. The implant enhances the vibrations of the middle ear bone and sends those amplified vibrations to the inner ear. Finally, the nerve signal is sent to the brain where it is recognized as sound. Auditory brain stem implants. They are different from cochlear implants. Instead of placing the stimulator in cochlea, it is placed directly on the surface of the brain. These are some of the adaptive devices for a hearing impaired individual. So, today we have learnt about what is hearing impairment and how a ear works. Then we moved on to see what are the different types of hearing loss and the characteristics or symptoms of hearing loss. Then we have understood what are the causes of hearing impairment, and we also seen the different tests for different age groups, and also we have understood the different adaptive devices which can help a hearing impaired individual able to hear. And lastly, we also have seen the way the hearing impaired individual can communicate through lip reading and American Sign Language. Hope you have understood this lesson, hearing impairment. Thank you.